Hello, everyone. Warm welcome here from Belgium. Thank you for joining our LinkedIn Live event. My name is Geert, and I will be your host today. And I'm actually stepping in for Paul Ireland, who is currently without a voice, and it's really due to a virus that was a headliner in the past couple of years. So I'm not going to mention the name. We're very honored to have important person today in our session, John Cogan. And to those of you who have not heard of John, please allow me to introduce him. John is the founder of JPC Advisory, a company focused on consulting in life sciences. And over the last 30 plus years, and that proves we're getting older, not to say old, John has held global leadership roles in life sciences, consulting, innovation, technology, and R&D operations. Most recently, John has led the global R&D practice at Syneos Health Consulting. And previously, John was CTO for Kinaps. Before that, CTO at Genpact Regulatory Affairs. And prior to that, John has had an extensive career within the industry, having worked for JSK, Shire, Daiichi Sankyo, and Mundi Pharma, amongst others, where he held various roles, including leading regulatory operations, R&D, IT, internal consulting, shared services, and outsourcing. So before we dive into the topic of today, one thing I'd like to mention is that we have a community on LinkedIn. It's a LinkedIn newsletter called Accelerating ECTD Submissions, where we share interesting information for the regulatory community. And if you have not joined it yet, we would love to have you join there. On a monthly basis, we share relevant content there. So, John, welcome to our session. To kick it off, there's obviously a lot of digital technologies that are out there and potentially very large number of use cases. So what are your thoughts about that, specifically if you look at regulatory?
Thank you very much, Curtin. Thank you very much for having me, and congratulations on the new DocShifter website, which went live today. It's very cool.
Thank you.
Digital innovation in regulatory and then economics. So I guess the way to break this down is first of all to look at what are the technologies we're talking about, and what are the potential use cases. So if you could pop up that first slide out, that would be great. So. This is a bit of an eye chart, and I apologize for that for now. What we're not going to talk about is the bottom part or the top part of this. So the bottom part here is what I call the system of record layer. And that's actually where there's an awful lot of investment happened in the last 5 to 7 years, particularly in regulatory. And as you can see there, everything is pretty mature, across that bottom layer. The big activity there has been, moving from on-premise to the cloud, moving to suites, and so on. And then at the top level, again, we're not really going to talk about that either. Again, mature technologies, IoT, master data, visualization. But I think the interesting way, if you present it in this way, Gert, what you see is you have these systems of record at the bottom, and you have the need at the top for visualization. And really, I think there's actually quite a lot of technology in the middle that's missing. So what are these digital innovative use cases in regulatory? If you flick the next one, the build, that would be great. So I divided this into two things, and again, arbitrarily, please don't get hung up on it, but it was a way to think about these things. So one is task automation. And as you can see, the technologies we're talking about here are robotic process automation, natural language processing, natural language generation, machine learning, all of these things. And you can see that they're in various states of maturity. I have noticed that mature on the right is green and in the middle is blue, but please go with that. RPA is actually a very mature technology, but a lot of the others are still really emerging. And in the boxes that you can see that are different colors, you'll see some use cases. What I've done with these is there's a number of forums in the industry. So you've got IRIS, the DIA working group, you've got the Hero Forum, you've got RIMNet, and in all of those, in various ways, I know that there are discussions about digital innovation and, what are these use cases? And so I've taken those and categorized them in here. And again, when we get to some examples later about economics, we'll pick and choose some of these, but hopefully the examples make sense. If you pop the next one up, so if the bottom one is task automation, this one is process automation, and I've thrown in user experience into that so that I can add in things like apps into the mix. But mostly this is about orchestrating processes and measuring them, and potentially simplifying the user experience. I think this is a really important one because one of my observations about the amount of funding that's gone into that system of record layer, I think there's been a lot of talk about user experience, about end-to-end processes, which really, at an enterprise level, I'm not sure we've yet delivered the full value of that. And the definitions of end-to-end can be pretty narrow in some of these cases. So I think there's still a lot of use cases out there that are looking at, workflow and task management, particularly, and in simplifying how users interact with the system of record layer. So those are some use cases and technologies that I think are applicable in regulatory.
All right. Thank you, John, for that overview. I've heard you mention on previous conversations, you talk about the economics of innovation. What do you exactly mean with that term, economics of innovation?
Yeah. So in terms of economics, and again, Alp, if you can flick to the next slide, I want to talk about two things. One is, why would you innovate, and then secondly, who should innovate. So I don't know. I think, is there a build on that slide, Alp? I think there might be one missing, maybe not. No, okay, that's fine. Go back up. So if you look at the top line, you could write this into a formula if you like, but I would propose to the audience that the propensity to innovate is inversely proportional to gross profit margin. So what does that mean? So industries that have very big gross profit margins do not have an as innovative mindset as companies with smaller gross profit margins. Now, I did have another eye chart that I decided not to put up, which shows all the different industries and how innovative they are across a lot of different verticals. And I don't think it'll surprise you if you saw in there that the pharmaceutical biopharma industry is actually not that innovative. And so one of the things that I would say contributes to that is actually the fact that we have very high gross profit margins. And if you want to test that, here's what I call the 5% question. So if you're looking at an innovation, how much benefit are you expecting to get from it? So if I offered you, if you're the head of regulatory and I offered to save you 5% of your annual budget in a year, what would you say? Now, I know nobody can answer that question, so I'll answer it. Most companies that I would talk to would kind of shrug and go, yeah, that's nice. I can probably manage that just by squeezing my sourcing, looking at my depreciation, by maybe even getting some foreign exchange in my favor. 5%, yeah, not too worried. Flip that around, and if you went to a financial services company, and you said, I offer you 5%, by the time you'd finish saying the word 5%, they'd probably have eaten most of your arm off. So I think we've got to be really clear when we look at these use cases. Why do we want to innovate them, and what benefit, in this case economically, do we think we want to get out of it? So that's one part. I'll just go to the second part, which is, and Alp, you can just build the whole thing together if you like. I know it builds, but just pop it all up on the screen. So this is what I call the three-legged stool, and it is a construct that that I put together, just trying to think about this topic of how do you innovate and who should innovate. So look at the three pieces of the stool, right? So up at the top, you got the life sciences companies, and those are the people with all the money. So you're the ones who, a lot of the people on this call want you to innovate because it means you're going to buy something. So that's super. You then look at the technology companies on the bottom right-hand side. These are the clever people with all the really cool technology. And then you have what I call the BPO, CRO, ITO, the large outsourcing firms that actually are a really big part of the ecosystem of how life sciences companies operate. So if you think about that, The technology company, if you have a technology that if you can sell it directly to the life science company, that's a huge payoff. The flip side is if you're a life sciences company, you are being bombarded every day by technology companies telling you they have the next best thing in insert AI, ML, RPA, BPM. And it's not really coming to you in context. It's just, I've got this technology. It's not really telling you, well, I've got this technology and it's going to do something for you. Now, there are some fantastic use cases where that isn't true. But um, all I'm saying there is, depending on what your technology is going to do, your chances of selling that technology directly to a life sciences company might be limited. Then you go to the other side, the BPO CRO community. If you think about the work that those companies do, it's usually, the high volume work. They run clinical trials. They have very big outsourcing projects, and in regulatory that'll be massive life cycle management contracts, things like that. So big, high volume, potentially low complexity. However, life sciences companies, while the CROs have a lot of selling power, their margins are a lot smaller because the percentage of spend means that life sciences companies are squeezing them all the time in terms of margin. And, that market is a very, very price sensitive market. So if you're a technology company, you might say, well, actually, my best route to market for my technology is to partner with a BPO, because then they can embed that into their solution and then deliver that to the life science company. The challenge with that is you probably dilute your message. You'll just become one little piece of whatever it is that company's offering. And of course, you'll see quite a lot of acquisition in the market, whether that's good or bad. You'll see the BPO CROs actually buying the technology companies. So you've got this three-legged stool, and I think it's important to keep it in mind when we get into the discussion about take a use case and then think about this innovation and who should pay for the innovation. So I'm sorry that that's quite a long answer. So the first part is, what is the economic benefit you want to get out of the innovation? And then the second one is really, how do you go about it, and who should do it?
All right. Thank you, John. I really like that analogy about the three-legged stool. You already touched upon the topic of who pays versus who gets the benefit. You
Yeah.
mentioned you had a number of examples. Could you take us through a couple?
Yes, I'd like to take you through the first one. Alp, if you pop it up on the screen, because this is a classic one, and there'll probably be colleagues and ex-colleagues of mine from the BPO CRO community looking at this one. But this is a really, really big use case, and I know that it's a little bit small in terms of writing, but what it says is the use case is business process management, BPM, and RPA in the automation of lifecycle management. So think about the scale of this. So Steve Gens would actually say that my 70% in that left-hand box is actually 80%. But if we say that lifecycle management accounts for 70% of all of the reg submissions that are made, so CMC changes, labeling changes, renewals, annual reports, all of that stuff. That work is also the work that is often outsourced, or if it's not outsourced, it's offshore to captive solutions, within companies. But the work itself is also then split up between in-house, BPO, nearshore, offshore. So no matter how good your system of record layer is in regulatory, many of the use cases in this scenario span the end to end of those, go beyond regulatory. So if you take CMC, change control, or you take labeling change, those things can start in quality or in PV, and they move through regulatory, and then they go into supply chain and packaging and manufacturing and so on. So the idea that any one set of systems of record could actually manage these end-to-end processes is actually false. So there is an opportunity then to codify that that process end to end, and certain tasks within that process you could automate using RPA. It sounds great, right? Well, if you know the technologies, so I do. I'm glad I'm on screen because I do wave my hands when I say this thing. But BPM is something that automates a process end to end, end to end. And on the previous slide, you'll see me mention process mining, which I'm also really big fan of, which is a way of measuring a process end to end. And then RPA is at some point in that process there'll be a step that you can completely automate just by using a bot. So really good use case. But think about the economics. So who should pay for that? Almost certainly the BPO should pay, unless of course you're a pharma company with an offshore captive and you don't have the thing outsourced. But it should be funded by the budget that executes lifecycle management. Definitely the sponsor company wants to benefit from that, even if it's the BPO that they want to invest in it. But if you remember what I said in the previous slide, that work, the work that's given to the BPOs, is actually really price sensitive. So the BPO folks on the call will be very used to deep RFP processes, offer, next offer, best and final offer. Margins start to get really, really depleted, and any money that's inserted for innovation quickly gets sucked up into the fact that you've probably underpriced it, and you need to use that money for actual delivery. So there's not a lot of incentive even though this could be a fantastic use case, there's not a lot of incentive in the economics for that innovation to happen. Now, the other thing to think about as well is, if the work that you're actually displacing, and this goes back to the point about what is the benefit you're trying to achieve, if the work you're displacing is work that's being done in a low-cost location, then your return on investment is going to be pretty long. So you have a situation where setting up one of these solutions can be quite expensive. By the time you've codified all the processes end to end, you've set them up specifically for the client. And I'm thinking about this from a BPO perspective. And then moving them from one client to another, sure, that can be done, and you'll have some base technology, but there's still an investment from a client to client basis. So I don't know how commonly this is done right now, and I know that some companies have certainly been talking about doing this, but I think there's a sort of a vicious cycle here where the benefit may not in the end actually outweigh the cost. So please don't take what I'm saying today as an overly negative view of the situation, but what I want really folks to think about is, when you think through all the use cases that are scientifically interesting, and wow, I've seen lists of use cases that are scientifically interesting. It's cool if you can do this. It's a bot is cool. Well, a bot might be cool, but it's no good if it actually costs more than than the person who was doing the job before that. So I just think these are useful lenses, and if you're the head of regulatory and you're being presented, by some group in your company with, loads of potential use cases and things to invest in, maybe this is a way of actually viewing that and testing, what is the benefit really, and who's going to pay for it. So that's the first one, but I do have a couple more if we have time for those, Gert.
We do absolutely have time, and I was about to ask. That was an interesting one. Can you take us through another one?
Yeah, Alp, if you've got another magic button. So yeah, this is another one. Now, we went from a really broad, potentially enormous use case in the previous example to a really narrow, but actually this one technically is very interesting. So, and I've used patient narratives, but there's a lot of potential use cases for natural language generation. And if you need to visualize what NLG is, it's like NLP in reverse. So if NLP is natural language processing, so you take lots and lots of unstructured data and then you create structure from it, what NLG is you take structured data and you create natural language from it. Very, very commonly used today in written, like websites that write sports reports and weather forecasts and things like that, where you can give. I often think of the baseball card. You can give a baseball card to an NLG engine, and it will write you the report of the match just based on the card of the data. So, patient narratives, thousands of them, right, for in clinical trial. And if you see how that data is created, it's usually a massive Excel spreadsheet with, I don't know, 50, 75, a lot of headers of different things, patient number, age, gender, I don't know, disease, location, blah, 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 right across. And then for every single patient that you have to write a narrative, there'll be a row, and there could be hundreds or thousands of them. So, this is an expensive thing. Medical writers are in short supply, onshore and offshore. They're highly skilled individuals, and having to do very, very repetitive tasks like this, it's pretty challenging. I will say I've seen some attempts using robotics to solve this, and they've been a bit. I've said suboptimal, but I'll say the word abysmal when I'm actually on the call. But that's kind of the idea, that you could have a piece of boilerplate text, and you would just using a bot to pick up the various bits and put it in the text. It just doesn't work. So nice, right? But who should fund it? Well, is it again, if you're a CRO and you're the one writing it, should you fund it, or is that something that the pharma company themselves will fund it? Because here's the catch. In order to create this thing, you will need hundreds, and I would possibly say thousands, of example narratives to train the NLG. So that is literally, feeding. I'm sure many people are familiar with how that works. So you have to feed the NLG algorithm examples of, well, this is what a narrative written looks like from this piece of input structured data, and here's hundreds of them. And then in the end, you'll end up with an algorithm that you can then feed them new structured data, and it will write the narrative. So it's pretty cool. I would say, though, from client to client, it's probably not that transferable, because different narratives in different therapeutic areas, you'll probably have to continually retrain your algorithm for each client, maybe each therapeutic area, even within the same client. But, and I think it's a big but, there should be a really big benefit here, because again, if you can save medical writing time, and I know that we've seen these new chatbots and whatever now that are writing essays and all the rest of it. So maybe that'll get pointed at things like this. If you can save the time to get something 80% good, and then have a medical writer do the last mile, I think that would be very good. But again, if you're being challenged with this use case, think about who should pay for it. Because if you want your BPO to pay for it, you're going to have to give them the data that they need to train the algorithm. So I have only got one more, Alp and
Yeah. No, great. And it's when I looking at this use case, I was indeed thinking of ChatGPT. It's very similar to what we're seeing happening in the rest of the world as well.
I wonder how anyone would feel about. I wonder how a company would feel about uploading their their patient narrative data to ChatGPT. That would be that'd be quite interesting. And I mean, intellectual property and protection, and the protection of patient data and personally identifiable information. Like, there's a lot of other stuff around this, but economically, I think this is actually
makes sense. Yeah.
Makes sense. And I have only one more, which is Reg Intel.
Please take us through.
If you're there, yeah. And then, Reg Intel or Reg requirements. This is the thing about using the same the same slide format. You sometimes don't notice when it's changed. But Reg Intel and Reg automation. This is a hot topic, and I've seen a lot of this. I mentioned Steve Gens before, and I know that Steve and his team are looking into Reg Intel right now, and I certainly know that a lot of the forums are looking into it as well. And there's some very cool technology in this space. But I think it's important to separate the difference between requirements and intelligence. So requirements databases have been around a long time. And often when I hear people talk about Reg Intel, they actually mean regulatory requirements. But if you, and you would think that there isn't a lot that should be unique from company to company there. So if you have requirements about how to make an active ingredient supplier CMC change, surely that doesn't matter what pharma company you are or what the active ingredient is. So, in many ways, that should be codifiable at least at the requirement end. If we think about actual intelligence, though, finding out things like precedent analysis, or maybe trying to predict trends that are going to come from governments in the future. I mean, that's a very different type of use case or scenario. So you think about the technologies. I mean, we've all been subscribing to these subscription services for a really long time. I won't name them, but yeah, you know who they are, right? So you can actually get requirements by subscription, but that isn't usually enough. Most companies need to add some sort of local intel or hard experience or something like that into that, and that's expensive to gather. And you can use things like web scraping, NLP, things like that. I mentioned precedent analysis. I'm very fascinated, and I've seen some presentations from some very interesting companies, particularly in the US, where they're going to mine FDA approval letters to try to get intelligence about particular therapeutic areas and particular drugs and so on. And then I've even seen RIM vendors claiming that they can present requirements data in context. So there's an awful lot of noise around this. But again, get onto the economics. We've been talking about this for a long time. So on the requirements thing, why don't the subscription databases just continue beyond what they currently do? Because what they currently do is they take anything that's publicly available on a government website and they collate that, they give it to you. But is there something holding that back? Like, why can't these services give you that local intel? Maybe because it's too expensive. Maybe there are legal issues. I don't know. The other side is, if in regulatory 30% or less of the work is actually the cool work, are you going to gain enough from an investment in a precedent analysis tool or the like that's really going to shift the needle for you in your company? So while it might sound like a great idea that you could mine the FDA, are you meaningfully going to shorten the approval time? And I don't know what the answer is, right? So again, what in this situation, like, what is the benefit? What's the quantifiable benefit? Is it you're trying to save 6 months on the approval, or you're trying to, I don't know what it is. So again, just another example. So I hope that we've stacked up potential use cases, the pieces of what does economics mean, and then put the two of those together and think through 3 use cases.
Yeah, thanks a lot, John. Indeed, we looked at innovation, we looked at the economics around it, and we looked at a few practical examples. So really, on behalf of, let's say, the entire audience, thank you very, very much for your valued contribution. It was a great pleasure of working with you and having you here on the show, if I may call it like that, today. This brings us, if I look at the clock, right about the time we should say goodbye to everybody that tuned in. Again, John, thank you very much. Maybe one last remark. The LinkedIn newsletter on accelerating ECTD submissions. If you haven't subscribed yet, please feel free to do so. We promise to not bombard you, but share relevant topics regularly with you for the regulatory community. Again, whatever the time of the day is, have a fantastic rest of the day, whether it's morning, afternoon, or evening. And again, thank you very much, John. Looking forward to see you in person.
Thank you, guys. Take care.
Right. Take care. Bye-bye.